Welcome back. Kauai, along with the rest of the state, has seen a big jump this week in COVID cases.
Before this week, the Garden Isle's previous high single-day case count was 62. Today, there were 127 reported by the Department of Health.
And joining us live now is Kauai District Health Officer Dr. Janet Berreman. Doctor, thank you so much for your time, as always, and for joining us tonight. So bring us up to speed. How would you describe the COVID situation right now on the Garden Isle?
Well, I think that we're seeing the same thing that's being seen statewide and nationwide, which is we're seeing exponential growth in cases, which we assume is because the Omicron is here, although we haven't confirmed that yet. But we expect to get those results any day now from the state lab. And certainly the way our numbers have been going up to the highest heights they've ever been at is very characteristic of what we're seeing with Omicron.
And besides cases, people are looking at hospitalizations. How are Kauai hospitals doing right now as far as handling patients with COVID-19?
Right. So we actually don't have as many people in the hospital with COVID as we have had at our peak. At our peak with Delta, we had 11 or 12 people in the hospital. We only have about 6 in the hospital now. Nevertheless, when I talk to our hospital administrators, they're concerned because the hospitals are more full than they were during the Delta surge with non-COVID patients, people who may have put off care and need to get their care now. And the other thing that they're seeing, as is being seen nationwide, although not as much here yet, is some staff outages due to being infected or being exposed and therefore quarantined. So our hospitals right now are doing fine, but they certainly are concerned. Like hospitals statewide, they've requested assistance from FEMA for additional medical personnel and are looking at bringing in hourly folks who aren't part of their regular staff to supplement their regular staff. So we're concerned, but we're doing fine right now.
Well, that's good to hear. Want to turn it now to the booster shots and vaccines. Maui County just announced that they're going to be changing the way that it defines what fully vaccinated is. So by January 8th, you'll need your booster shot to be considered fully vaccinated. Is this something that you think should be implemented statewide?
Well, so many of these regulations are at the county level. So I believe Maui has a requirement that you be vaccinated or tested, for example, to go into restaurants. Kauai County doesn't have that, so it wouldn't be a meaningful requirement for us. But I do think that what we're seeing is a movement toward the recognition that the booster shots are extremely important, especially for protection against Omicron. And the new isolation and quarantine guidelines that the CDC issued and the Department of Health will be implementing on Monday, those do essentially redefine fully vaccinated. In order to be exempt from quarantine, if you've been exposed, you have to have had your initial vaccination series. And then if it's been more than 6 months for Pfizer and Moderna, you need to also have had your booster vaccine. Or if it's been more than 2 months since the Johnson & Johnson, you need to get your booster vaccine. So I think the importance of boosters and requiring those in more and more settings is definitely the direction that we're moving, not only nationwide, but statewide as well.
Doctor, as you said, the hospital situation seems to be fairly stable right now, but this week we've been seeing record numbers of COVID cases. How high do you think the count will get before it finally starts to come down?
I really can't project how high it's going to get. We know that this exponential growth, where it can double in as short a time as a few days, has been seen elsewhere. And how high it will go, I think really only time will tell. We're fortunate that we have a fairly well-vaccinated population, but we know that we also have lots of holiday gatherings and lots of holiday travel, and we have Omicron here, and all of those things, unfortunately, are working against us. So I certainly don't think we've seen the peak yet.
Public school students will head back to class next week, along with teachers and staff. So is it safe? Should parents be sending their keiki back to school right now as we see more pediatric cases of COVID-19?
Well, so first I would say that any keiki who are old enough to be vaccinated should certainly be vaccinated. And if parents are worried about their children's safety and health, that's a very big step they can take. The other thing is that we've really seen over the last many months that the layered approach to disease prevention and to protection of our keiki in the schools has been very, very effective. And we have not seen a lot of large outbreaks in schools. And we know that the same things that we've done for Delta are effective for Omicron: masking, distancing, minimizing groups, improving ventilation, and vaccination. And we know that it's very, very important for our keiki to be in school. So I think that adhering to the, schools are the first to open and the last to close continues to be the right thing to do. And parents and schools need to continue the excellent work that they've been doing to protect their keiki.
Doctor, as we start to wrap up this interview, as we look ahead to 2022, any reasons you can give us to be hopeful for the coming year?
Oh, wow. Yes, a year ago at this time, we were really just starting vaccinations, and now we have over 70% of our population fully vaccinated. So I think the thing that people can do to improve my hopefulness is to get their booster shot if they're eligible for it, because that added layer of protection, it's increasingly clear that is just critically important. We all have a lot of experience with the COVID protections, and I think that's both a good thing and a bad thing. We're all tired of them, but we all know how to do them very well. So I actually think that our residents and our communities are going to continue to do the right thing to keep us safe and healthy. And I'm optimistic. I think we'll have a rough start with very high peak of Omicron, and it's going to be, another hard few weeks or months to get through. But I think we're going to come out the other end just fine and resiliently, as we always have. So I have faith in our community and our residents.
Sounds good. As always, thank you so much, Dr. Janet Berreman, of Kauai District Health Officer. Have a happy and safe new year.
Thank you so much. The same to you.
Thank you.